Hello and welcome to the Children's Safety Network webinar on the Child Safety Learning Collaborative, using quality improvement to accelerate your work. This is sponsored by the Children's Safety Network. And before I move on, we've had a lobby poll, and I just want to acknowledge that we have a great array of people here today, ranging from maternal and child health coordinators at the state level, and injury prevention coordinators and personnel, as well as community-based prevention practitioners, healthcare providers, and even some teachers and professors that are joining us today. So we're really excited to have such a rich and diverse group of people. This project is funded by the Health Resources Service Administration of the U.S. Department of Health and Human Services. And I want to just emphasize that anything that we share today is not a statement of the U.S. government and is not an endorsement in any way. I'm going to turn this over to Kristen Boudreau, my colleague, to share some technical tips to get us started.
Hello, everyone. Thank you for joining us today. Some tech tips. Please join your audio via your computer if possible. If you experience any audio issues, you can dial a phone number found in the Zoom invitation and mute your computer speakers. You are muted and you will remain muted for the entirety of the webinar. You can use the chat button found at the bottom of your screen to ask any questions or add any comments at any point throughout the webinar. This session is being recorded, and the recording and the slides will be sent to all registrants and will also be posted to our website within 1 week of today. And if you are in need of captions, you can click the More icon at the bottom of your screen, then press the Captions icon to turn on automatic captions. And throughout the webinar, we will have resource files and links shared in the chat. And now I'm going to hand it back to Jenny.
Thank you so much, Kristen. And I see that there's a question in the chat about renaming yourself. We do encourage, in order to build some community today, that you go ahead and rename yourself. And Maria has posted some instructions in the chat on how to do that. It is not mandatory, but it's just a nice way to get a sense of who else is in the room with us today, who might be from your state, and perhaps to see even your colleagues. All of the participants, as you noted, are muted, so we aren't able to take any verbal questions, but please do readily use the chat and ask questions as we go along throughout. I now want to just introduce who you'll be hearing from today. So I'm Jenny Stern-Carasone. I am the CSN Associate Director. I also serve as the lead for the Child Safety Learning Collaborative and the topic lead for our motor vehicle traffic safety team, addressing both child passenger safety and teen driver safety. We also have today with us Maria Catradas, who is a senior training and technical assistant with CSN and serves as our topic lead for the Child Safety Learning Collaborative's suicide and self-harm prevention team. Claire Grace Jones is a training and technical associate with Children's Safety Network, serving as a topic lead for our sudden unexpected infant death prevention team on the CSLC. Additionally, today you will be hearing from some of our teams that participate in the CSLC. Jennifer Miller is the Title V Maternal and Child Health Director at the Kansas Department of Health and Environment. She's been in this role since February of 2023, and in this role, she oversees the work associated with the Title V Maternal and Child Health Services Block Grant, the Kansas Maternal Mortality Review, and Kansas's psychiatric access programs. Also, Jennifer is currently working with the Injury and Violence Prevention Section Director on the Children's Safety Network Collaborative on suicide and self-harm prevention. Prior to joining KDHE, Jennifer worked as a program director for the bachelor's degree in public health at Kansas State University. We'll also hear from Danya Caldwell, who is an implementation specialist at the Georgia Department of Public Health on safe infant sleep and bullying prevention projects within injury prevention programs. She received her Bachelor of Science degree in biology from Xavier University of Louisiana and her Master's of Public Health from Purdue University Global. Danya is currently working towards her Doctor of Health and Sciences at Purdue University Global. Outside of the the Georgia Department of Public Health and school, Danya enjoys reading, spending time with her family, being outdoors, collecting Minnie Mouse ears from Disney parks, and crafting. Right up my alley. Today, we are going to be addressing several things. So our agenda is an overview of the CSLC, hearing from the teams as examples of quality improvement in injury prevention, and then looking forward about what's coming up next in our CSLC timeline. With that, I am going to turn this over to Maria Katratis.
Thanks, Jenny. And thank you all for joining us today. It's really exciting to be able to talk to you a little bit about the Child Safety Learning Collaborative and all of the great work that the states are doing. So I'll take you a little bit through what we do at CSN. So next. So we're established, CSN was established through funding from HRSA's Maternal and Child Health Bureau in 1990. And we are the MCHB's primary vehicle for providing technical assistance to Title V agencies on injury and violence prevention. There are 4 main components to our work: our national partnerships through the Children's Safety Now Alliance, and I see a couple of folks have joined us on this webinar today. We offer training and technical assistance to all states and jurisdictions, as well as develop free webinars and resources on a wide variety of child safety topics. So today, I'd like to share some highlights from one of the components of our comprehensive work, which is the Child Safety Learning Collaborative. Next. So since 2015, CSN has hosted 3 iterations of Learning Collaborative, which include 2 cohorts of the Child Safety Collaborative Innovation and Improvement Network, also known as the CS Coin, 3 cohorts of our first iteration of the Child Safety Learning Collaborative that just ended last year. And we are currently in the first of 3 cohorts of the second iteration of the Child Safety Learning Collaborative, which we will run until 2028. Next. The Child Safety Learning Collaborative vision is to actuate CSN's mission by providing targeted technical assistance to Title V agencies in order to effectively advance injury prevention strategies and reduce child and adolescent injuries, hospitalizations, and fatalities nationwide. Next. So what do we actually do in the Learning Collaborative? We'll look a little bit at the features of our Learning Collaborative. Learning collaboratives are commonly described as a systematic approach to process improvement, where participants share their experiences to accelerate and broaden implementation of best practices. The design of the CSLC is for states to create strategy teams to address each of the injury topics, and we'll talk about that in a bit. And then the Learning Collaborative convenes the state strategy teams into topic teams, where we use quality improvement methods to build on shared aims, evidence-based approaches, data analysis, and targeted technical assistance to accelerate the implementation and spread of effective strategies. The goal in the CSLC is to help states and jurisdictions employ the public health approach, close the gap between research and practice, and support evidence-based practices to reduce child injury and violence, and demonstrate significant change over the 5-year period. Next. So here you see the CSN framework for quality improvement and innovation in child safety. And we've actually have published 2 articles on our work using the CSN framework. If you've attended any of our state technical assistance webinars, you may have seen this before. The framework draws on elements of the CDC social ecological model, the Foundation Strategy Group's collective impact approach, the Institute for Healthcare Improvement Breakthrough Series, and Associates in Process Improvements Model for Improvement. The focus of the framework is to support states to make improvements and innovations in their child safety systems and develop their child safety workforce, which we believe will lead to positive health impact in the populations we serve. Health equity underpins the entire framework, and it enables states to effectively use data to understand and target populations and identify which areas they want to focus on. To build public will and a state jurisdiction capacity in key areas essential to achieving sustainable and scalable child safety results, the CSLC targets the following core tenets of the framework, which is that pie circle on the left: the identification and use of data, evidence-based and evidence-informed strategies and programs to enhance child safety expertise; increased effectiveness of management and leadership, and systems improvement through ongoing commitment to shared learning and principles drawn from advances in improvement and implementation sciences. Next, please. So one approach that we leverage in the CSN framework is the model for improvement, which is a tool for accelerating organizational improvement. The model centers on clarifying the aim, or what are we trying to accomplish. The next step is to determine the changes that you think will result in improvement and decide what data to collect and analyze to know that the change is actually an improvement and not just a change in circumstances. And then we also use the Plan, Do, Study, Act cycle, which is the primary tool to conduct small tests of change to effectively try new child safety approaches and interventions throughout the system and to adapt them to ensure they are working before implementing them system-wide. So next, please. Oh, great. So returning to our framework, we know that these are three cornerstones that are essential to success. The three components of that pie: child safety expertise, management and leadership, and systems improvement. We offer resources and support in all three of these areas, and there's no wrong door for requesting technical assistance. A significant component of the CSLC and CSN's work in general is providing strong technical assistance, where we bring our collective expertise as a team, our connections with experts in the field, and a customized approach based on where you are at the moment. And we'll be sharing a link to request technical assistance in the chat. Our technical assistance is tailored to the needs presented by individual state strategy teams, topic teams, and the learning collaborative as a whole. So this can mean designing webinars to meet emerging needs with experts from the field, innovative approaches, new research, or emerging practices. It can also mean designing tools to assist states in developing and sustaining effective partnerships, or providing training and tools to help Title V agencies establish an improvement portfolio that integrates with overarching state objectives and builds a culture of change. So here, as I mentioned earlier, we're in the first of 3 cohorts of this iteration of the Child Safety Learning Collaborative. Each cohort is approximately 18 months, and the application period will reopen for each cohort, and all states and jurisdictions are encouraged to remain in the collaborative for successive cohorts and add additional topics in successive cohorts while continuing work on earlier topics. We will also open up the application period, the application publicly, so new states can also join the Learning Collaborative. Some of the states that we are currently working with, us have been are in the 6th cohort of CSN Run Learning Collaborative, while others are in their first. So the primary goal of the Learning Collaborative is to reduce fatal and serious injuries among infants, children, and youth ages 0 to 19 by supporting collaborative improvement among state and jurisdiction level Title V agencies working to address child safety. So within each injury topic, the focus of the work for the collaborative is to identify areas ripe for improvement, to develop a system of support and innovation and sustainability, to use data to inform your decision making, and to implement and spread evidence-driven strategies and programs. Next, please. Here's an overview of CSLC activities. At the start and end of each cohort, each team completes a brief questionnaire that gives us an idea of where they are. Once we get going, we focus on monthly data collection and reporting of measures that indicate whether there is improvement in your injury and violence prevention systems. And having this data enables teams to accurately and rapidly assess their implementation strategies. We also conduct monthly PDSA cycles and have monthly calls that talk about our data, progress, challenges, and lessons learned. And as I mentioned earlier, we also have state technical assistance webinars that are public and that you can all join us on. Next, please. So these are the 4 topics that we're working on in our current cohort. We have bullying prevention, motor vehicle traffic safety, which includes child passenger safety and teen driver passenger safety. We also have suicide and self-harm prevention and sudden unexpected infant death prevention. And in cohort 2, we will be adding drowning prevention. Here's a quick overview of our QI process, and it's often said that in order to achieve results, it's important to do, not just say. So we do our best to help states put the words of the change packages that we offer into action. This is a brief overview of the process. First, we help states establish their strategy teams and select the strategies and measures, and then we help them develop a plan and monitor their progress so that they can clearly identify what they want to accomplish, how they know a change is an improvement, and what change they can make that will result in an improvement. Next. And here's a map of our participating states in cohort 1. And if you're interested in joining us for the next cohort, we will share more information at the end of today's webinar. So now that you know what we do from CSN's perspective, I would love for you to hear from Jennifer Miller from the Kansas Suicide and Self-Harm Prevention Team and Danye Caldwell from our Georgia Bullying Prevention Team to share with you their thoughts and perspectives. So over to you, Jennifer.
Thank you so much, and thank you for the opportunity to be here today and share with you about Kansas experience so far with the CSLC. This is actually our first time as a state participating, so it's been a really great learning process so far. Next. So with the CSLC, we saw the opportunity, myself and my children and youth with special healthcare needs director. So we took it to the injury and violence prevention team to ask kind of what their interest level was. And we, went back and forth around what of those topics made the most sense that aligned both with the work that the injury and violence team was involved in, as well as what Title V was doing. And ensuring that we really looked at what our data was to make sure that whatever we selected really was reflected as a need in our data. Next. So one of the things that we regularly track, both just as a state, but also particularly for our Title V annual report and application, is our adolescent suicide rates. So as you can see, with the 3-year rolling average, we have seen a little bit of a spike, and then it's pretty much maintained that. It's also something that we have had a lot of attention within our legislature on this year, even with the passing of a new law around suicide. So we thought this was a really, seemed like a really good potential fit for us as a state. Next. Then within Title V, we are currently kind of towards the end of our current state action plan. But 2 of the objectives we have been working towards are really creating those positive lifestyle interventions, prevention efforts, resources for our child and youth population, as well as trying to increase the number of providers we have in the state that are really able to help with screening, providing brief intervention, and referral to treatment for anyone at risk for behavioral health conditions. Also within our state, we have the pediatric mental health access program. We call it Kids Map. And so a lot of their work is also around helping to train the workforce about how to recognize behavioral health needs in youth, as well as providing a consultation line so that when they do have a patient and they're not sure what they're seeing, or they're not sure what the best course of treatment is, that they can get real-time feedback from a team of folks that work in the adolescent behavioral health space, including a couple child psychiatrists. Next. This also, we felt like, looking at our Kansas suicide prevention plan, there was also a lot of overlap there with some of the things that we were thinking about in relation to how we wanted to advance our work around self-harm and suicide prevention. So really trying to increase the data that we have that's available to help us plan intervention, messaging, that type of thing around suicide and self-harm prevention. Also really being able to be strategic in how we think and approach those messages, making sure they're relevant to the audience that we're trying to reach. And also really being aware of the culture within Kansas and the different, we have some very rural areas, we have some frontier areas, and we have some very populated areas. And so really trying to figure out how to reach each of those, especially when a lot of our rural and frontier populations don't have access to the same services that we see in our urban areas. Next. So we put in the application and were approved and joined the cohort this year. Really excited about that. Particularly for me, it was great because I have a background in maternal and child health, but primarily my work has been in really just pregnancy up to age 1. And so kind of really wanted to expand my understanding and involvement in some of those child and adolescent domains so that I could get a better understanding of the work and the needs in those areas. So Dana, who is the injury and violence prevention director, and I got together and started brainstorming around who really needed to be at the table. Who was already doing work in this area? What kind of work was already happening? How did we make sure we aligned efforts instead of replicating them? How are we going to kind of create that buy-in? And then also really thought through what is manageable for us, given capacity issues, given funding issues, all of those pieces that are really important in being able to drive the work forward. Next. So what we ended up doing is initially we had a small group that we started meeting with around the work, and came to find out that we had an existing youth suicide prevention group. So, and most of the folks that we were already meeting with were already on this other committee. So we went, it's hosted out of the Attorney General's office. So we went and talked with them and were able to actually just combine that meeting and include the CSLC as a standing item on our agenda and create that buy-in with a broad set of partners across the state. So far, what we've really focused on is developing our aim statements, really starting to review as a team the change package, potential strategies, activities, and data measures that align with what we're not only wanting to change in the state, but also how do we build upon some of the efforts that are existing. Then Dana and I were both able to be at the in-person gathering, and that was really helpful because there are several states that are involved in the CSLC that have been doing this work through multiple cohorts. So it was really meaningful to be able to have that interaction and hear from them and their lessons learned, and to be able to connect with the CSN staff. They've really been wonderful in giving us support. And so we came back from that really feeling like we had a better handle on where we wanted to go, and finalized some strategies and data measures, and then took those back to our team. Next. So we selected the aim statement that by 2030, we will increase access to self-harm and suicide prevention education and resources for youth aged 11 to 18 years by 5% in the state. And then selected a couple change ideas, which included really trying to engage with some of those new and emerging technologies, and increasing resources like 988, like the chat and text lines, particularly for our rural and frontier children and adolescents. Just again, as I had mentioned, there's been significant challenges in getting some of those resources there. So really looking at how can we be more effective with what the resources we have, as well as build on them so that those areas are more well connected and know about the resources that are available. Next. So some of the things that we're going to be kind of starting to measure are looking at how many people are we getting involved, how many people are sharing out the messaging, hopefully even being able to track how many times, like if we post something on the Kansas Maternal and Child Health web or Facebook page, how many times that was viewed, those kind of things. Also looking at how many products of dissemination have been made. Also with Kansas, we have a Friend Asks app. And so we also really want to encourage that. And then, of course, looking at our Essence data for emergency department visits. So those are some of the things that we have really decided to try and focus on. Next. So we have buy-in from the team. And so now we're kind of in the process of figuring out, so we have this big broad aim statement, but how do we start breaking that down into manageable pieces, into pieces that we feel like are, going to work, that we can try and tweak as needed. So we actually have our next youth suicide prevention meeting tomorrow, and Maria is going to be joining us to kind of talk with the larger team about the process, as well as help us think through potentially doing like a needs assessment or something to help us identify where those areas in particular that we should focus our time and our energy in getting those resources out to. So we're hopeful that by the end of that meeting, we'll really be able to have that 90-day aim statement ready and really get the whole team up and running and ready to go. And I will say that's been one of the greatest parts about working with the CSN team, is that I feel like I can email and call and just say like, hey, this is where we're at. This is some support we need. And they're always really readily available. Also, knowing that there are other states that are also working in this area, we're able to reach out to them, kind of get a sense of what they're doing. And so it's just been really helpful to have access to those resources to help our team as well. Next. And then that is it for me. And I believe we will do questions at the end. Thank you.
Now we'll hear from Danya.
Thank you for having me. Again, my name is Danya Caldwell, and I work at the Georgia Department of Public Health in our injury prevention program.
Danya, you've muted yourself.
Oops. I'll try that again. So our bullying prevention CSLC team is made up of different injury prevention program team members that are working on different projects. So our team was selected based on those who have a vested interest in working with bullying prevention, or whose project areas also have an aspect of bullying prevention or similar health disparities and shared risk and protective factors. So as you can see, we have myself, Nikita, Ansley, and Terry on our team. Next. And I just wanted to give a brief introduction of actually what bullying consists of. So when we are talking about bullying, it is characterized as any unwanted aggressive behavior or behaviors by any youth or a group of youths involving an observed or perceived power imbalance. It is also typically repeated multiple times or is highly likely to be repeated. And bullying itself can inflict harm or distress on the targeted youth, which includes physical, psychological, social, or education harm. And I did want to note that according to the CDC, bullying is highest amongst middle school students, then is followed by high school, and lastly, primary school students. Next. The vision that our Georgia team has come up with, and our vision is based off of our 90-day aim statement, which we had the help of the CSLC and CSN team to create. So our vision is to educate school staff, youth serving organizations, family members, and the community on how strengthening protective factors against ACEs or adverse childhood experiences contributes to a reduction in bullying. We also want to motivate our school staff and youth serving organizations around the state to be bullying prevention advocates. We find that this is very important because bullying has a negative impact on all of those involved, including the bully, the one who is being bullied, and bystanders, or those who are witnessing the bullying. Next. Currently, Georgia has partnered with the Southeast Conference on School Climate, so that we can reach different members in the schools. So there are like principals, teachers, school nursing staff, school counselors, youth serving organizations. Members of those all frequent this conference. And we chose it because they focus on positive behavior interventions and supports youth I can't get it out right now. So we're just going to keep going. Mental health, restorative practices, school safety, mindfulness, and well-being. And we are currently in the process of reaching out to other youth serving organizations that specifically serve the LGBTQ plus youth, so that we can find out what types of bullying prevention policies they have in place, if there are any. Next, please. So we are reaching out to parents of LGBTQ plus youth, also known as PFLAG, LGBTQ plus youth groups, trans support group, rainbow support group, and the UGA 4-H extension to start with. And once we have kind of gathered our data and have figured out what type of bullying prevention measures they are using, then we will continue to support them. If they don't have any policies in place, we want to help them develop those policies, because we want all youth to feel supported, and we want all youth and leaders to feel that they have the tools in their back pocket to help to prevent bullying. Next, please. And my contact information is on the screen. Feel free to reach out if you have any questions. And thank you to everyone for allowing me this space to present the information.
Stupendous. Thank you so much, Danya and Jennifer, for sharing. As we move towards our discussion and question and answer time, I want to encourage folks to put any comments or questions that you have into the chat. Again, that's how we'll hear from you today. And I just want to share a little bit about what's next. So as we said, CSN works, very much with partners, and you heard from both of our presenters today about the importance of partners in their work. We provide technical assistance at request, and that link should be showing up in the chat so that you can reach out at any time. Our technical assistance can be requested through our website via this link as well. We also provide some, ongoing resources and webinars. We have a great state technical assistance webinar archive about building effective teams to address Title V priorities. We have resources such as the Health Equity Planner to implement and spread child safety strategies in communities, as well as a collaborative resource that we created along with Safe Kids Worldwide and the National Center for Fatality Review and Prevention on health equity and working as an assessment guide for multidisciplinary teams. And there are many other resources available on our website. As we move forward, you heard that we're in cohort 1 of the current Child Safety Learning Collaborative, and we are moving towards summing up the cohort in May of 2025, and then launching the second cohort. And as Maria shared, our cohorts are designed so that teams are encouraged to start in a cohort and to continue into successive cohorts in an effort to be able to enhance and continue building on the work and momentum that they've started in initial cohorts and expand on that. We often see also that current teams may, or states, I should say, may initiate new teams. And so, for example, Danya and the Georgia team was in our prior CSLC working on sudden unexpected infant death prevention, and now has joined our current cohort and has expanded their work to utilize the CSLC to support initiating work in bullying prevention. The application time is an opportunity for new states to join us and to begin this work. And we encourage folks to consider this. Applications will be available on the CSN website with more information at the beginning of 2025. We will then accept teams and begin orientation and begin the cohort in May of 2025, integrating new and ongoing teams at that time. To learn more about applying, we will have several orientation sessions coming up, and these will all be posted on our website, and they'll have registration opportunities. So we encourage you, if you are not already a member of our CSN newsletter, to please join so that you can stay apprised, or just visit the website for more information moving forward. As Maria noted, we will continue working on our current 4 topics of bullying prevention, motor vehicle traffic safety, which addresses both child passenger and teen driver safety, suicide and self-harm prevention, sudden unexpected infant death prevention, and we will also be adding the new topic of drowning prevention for cohorts 2 and 3. So now I want to turn it over to the panelists for some question and answer time. And again, encourage folks to put in any questions or comments that you might have to share with the panelists.
Thank you. Oh my gosh, such good information. Thank you, both of you, for everything that you've shared already. Oh, and we have a question that's already popping in. Are there opportunities to collaborate with teen driving programs? I don't know if that's something that either of you can speak to, or if Jenny, if you want to pop in and speak to that as well.
I am happy to join. I think I have to be spotlit to join you, though.
You are?
Yeah, so it appears from Catalina's question that she's looking for opportunities perhaps to collaborate with other programs. She's a car seat, certified car seat technician, and that's wonderful. So in terms of collaborating, I mean, obviously there's always opportunities. We encourage states to reach out to one another. That is one of the salient benefits of being a member of the Learning Collaborative, is that you build these relationships. We heard from Jennifer, at the rich opportunity to meet other states that are doing your work. And so that's, the easiest way is to join the collaborative in the coming cohort, and then you can connect to other teen driving programs and so forth. We do not have any other formal mechanisms that would connect you to teen driving programs nationwide. We don't run that kind of a network. Aside from the Learning Collaborative, where we have teams working on motor traffic safety, and you would connect in that way. And of course, we also are more than welcome to answer any TA questions you have. And if we know of a state that is doing work that might be in alignment with what you're doing, we can reach out and see if that's a connection we can make for you.
And
I
Jenny,
would just like to
yeah,
add that if you really are interested in being able to collaborate with other states, that the CSLC is the place to do it. Like Jenny said, Georgia was a part of the last cohort, but in a different topic area.
So while we're waiting for some additional questions to come in, and I really encourage people to keep those coming in the chat. Danya, will you, and Jennifer, you both, I think, answered a little bit of this already, but do you have anything else that you would want to add around why you joined the CSLC? Like, what was kind of that one motivator that you were like, oh, this is why I want to be part of this?
So part of the reason why I joined, especially this cohort with different topic area, was because I really wanted to see what other states in the network were doing as far as like what they already have for their bullying prevention measures, so that we can figure out how to just continue to expand our bullying prevention efforts within the state of Georgia. And I would also add, because there's so much assistance that we get from like flushing out the AIM statements, the PDSA cycle is really helpful, and just constantly having like the check-ins that's really helpful for me.
So that it sounds like that piece of not only, you know, getting the quality improvement support, but also the tools. And I will say from my own experience, also having it like broken down into small pieces, like it feels so overwhelming when you think about quality improvement. And so to be able to say, okay, first, we're just going to decide where it is we want to go and what we want to do and create this statement. Then we're going to look at this a short chunk of time at a time and figure out where we're going. And then there's, you know, kind of support all along the way. Great. Jennifer, do you want to add anything? I can't tell if Jennifer's frozen or just thinking about the question, but it looks like maybe she's frozen. Oh, there you are. We lost.
Okay.
Great. Do you want to add anything?
Yeah, I would just agree. It really is nice to have that collaboration with other states and kind of getting to hear and learn from what they've tried and where they've been successful. I think especially because Kansas tends to be like a conservative state. Like if, you know, someone from California is like, we tried to do this and it didn't work for us, I'm like, cool, that will never fly in Kansas then. So like it's really good to have that back and forth just to hear what other people have tried.
Awesome. So is there anything in addition to what you've shared already that's really in a way that the CSLC has really helped you to move your work forward?
I would say that working with the CSLC has really pushed my thoughts on who can be a partner, and what it looks like to partner with different organizations, because I never really would have thought of, hey, guess what, there's a conference on school climate, why don't you partner with them and see what kind of feedback, sorry, dogs are barking, what kind of feedback you can get there.
Oh, go ahead. Yeah, please, Jennifer.
Yeah, I was going to say, I also just think, especially coming into my role, like the maternal and child health field is so broad. And I had really only had familiarity with one portion of it. It's been a really good experience just to see what is occurring within the state of Kansas, who's already doing the work, and how can we partner instead of like feeling like, oh, Title V, you have to do everything. It's like, no, like you need to partner with the people who are already doing it successfully and support them.
And I know you've both talked about partnerships. I'm curious, in your work, especially if there was maybe something that came from your participation in the CSLC or your technical assistance, or really just in general, anything you want to add around, innovative partners, like partners that you're like, oh, I wouldn't have thought to connect with this person, and now this has been a really helpful, piece to move the work forward, either from this cohort or Danya, from your experience in the previous cohort. Do either of you have some thoughts about making those connections with innovative partners?
I know, and when we were in the SUID like the last cohort with the SUID topic team, one of our partners was our tobacco cessation manager. And that was a really fruitful connection to have made just within our own organization, because when you're in different departments, sometimes you don't have that interaction. And we are continuing to work with the tobacco cessation manager to make sure that we are decreasing the amount of tobacco smoke that is around infants.
Awesome. Okay, yeah, please.
Yeah, I was gonna say, I think for me, the most unique one is that we have partnered with Kansas State's research and extension offices, which gives us a really broad reach because they do have offices in all counties across Kansas. So it's kind of like a real quick in, and they're already doing a lot of work with youth. And so they've been really excited to partner. And I think across the board, that's probably a resource we've underutilized as a state. So I was really excited just to make that connection and kind of see some of the work that we can partner with them to do.
Yeah, it's interesting. I was on a webinar not too long ago for another project that I'm on, that serves out of school time folks. And we had someone that presented about how they happened to make a connection with someone from their county extension, and it became this amazing partnership that actually then brought in additional partnerships and now is a really core piece of their program. So thank you for that. For lifting that up. And I think too, to Danya's point also, I hear that often in working with states in terms of, just public health departments are so big and often become siloed because folks are, working within their own bureau or division and their own kind of set of, grant requirements and awardees. And so sometimes it's even, as you're sitting around the table brainstorming partners, it's not even just thinking like, who's community-based or who's sort of out there that we can pull in, but who is within our own department that maybe has shared risk and protective factors, shared goals that we can be, making these connections with. So I really appreciate you lifting that up as well. Maria, it looks like you came off a video. So did you want to add something?
Yes, I would like to respond to Denise's comment in the chat. So Denise mentioned the America's Poison Centers, and that some of the centers are participate in suicide prevention, which is a really good example, I think, of how the broader work that we do at CSN also influences the CSLC. So our CSN EDARC, it's their Economics Data Analysis Resource Center, looks at all of the national data sets to see any trends that are happening and to identify the highest the rates, the incidences of each of the topics, so that we can select the topics in the CSLC and also look at different mechanisms. So we know that we've had a lot of discussions of how there's overlap between poisoning prevention and suicide prevention in looking at poisonings that had suicidal intent, and the difficulties then of also identifying it. So some of the work that we do with some of our national partners, like the National Center for Fatality Review and Prevention, also help us identify where those gaps are and where some of the areas are for improvement so that we can also reach out to states and sort of find ways to address it. So if there are states that have a higher incidence of these poisonings, that is a really nice way to marry some of the work that folks are already doing in poisoning prevention with the suicide prevention work. The same thing with there's overlap between bullying prevention and suicide and self-harm prevention in terms of like providing socio-emotional learning and developing resilience in young people so that they can grow to be healthy adults. So there are a lot of overlaps, I think, in what we do, and it's always lovely to hear some comments also that can really open up a new door for us to explore and really see the way that we've interconnected a lot of the work that we do in our field and in our different topics. Likewise, there's good decision making discussions happening in teen driver safety. There's parenting discussions happening in teen driver safety and in suicide prevention. So there's a lot of ways that we can think through who has access to people in our states and then how we respond to them through our technical assistance to the state and jurisdiction health departments.
So Maria, speaking of, I'm going to build on what you said for our next question for the panelists. Thinking about, decisions and what partners you're going to bring in. I know that we have a lot of tools available on our public facing website, as well as a whole suite of tools, especially around quality improvement, that are available specific to those that are participating in the CSLC. And I'm just curious if there's a particular tool that's kind of your go-to or your favorite or that you've used during this work.
I will say that the PDSA is my favorite QI tool, just because, like you spoke about earlier, Claire Grace, it's a lot easier to kind of take things one piece at a time versus big picture, like full big picture planning. It's like, okay, let's test out this one thing here, feedback from participants, and then we can add on the next layer of it.
Thank you.
Yeah, I like that a lot, as well as I really enjoyed like the change packages, because like, I think when I first started, it was like, okay, we're going to address self-harm and suicide prevention. And I'm like, cool, what does that mean? Like, what do we really do? And so like the change packages, I just feel like they present a lot of different, change ideas and strategies that can then help you really start to tailor down like big picture, this is what we want, and here's how we can easily get there.
Yeah, I love that about this project is it gives you this really nice sort of menu of already researched, evidence-based strategies. So you can pick and choose what feels like the best fit for your context. It's not prescribed, like everybody's going to work on these two. It's like, here's this whole long menu. You pick what's going to best for you. You pick which measure is going to best work, for your environment, or maybe you're picking multiple measures because you've got rural folks and you've got urban folks and you've got tribal land and so that's great. Thank you for sharing that. So my last question for each of you, if you want to just briefly kind of wrap this up for our panel discussion, what would you share with a colleague who was thinking about joining our next cohort? And I'm going to let Jennifer go first.
I would definitely say to just go for it. Like, even if you're not 100% sure, like which area you want to work in or what that work could look like for you, there's just a lot of support in figuring out all those pieces, once you sign up. And so I know Maria has just been really wonderful to work with, and like, email her whenever we need something to help us like kind of figure out, this is what we're thinking. Are we on the right track? And I just feel like it's really worth the time investment, because you get to really see a project start to move.
Awesome. How about you, Tanya?
I would also say to just go for it. And it's okay to switch topics within the CSLC, because from the time that I've been in, you really kind of gain like a new support group and a new like working family, who you can bounce ideas off of, who are outside of your organization. And I also love to hear what's happening in other states. So like Jennifer mentioned earlier, like hearing something that didn't work in California may not work in your state as well if it's, already not working somewhere else. Or, there may be something that you hear, maybe it didn't work, but maybe you're able to think of a way to tweak it, and then you can try to implement it within your own state.
Thank you so much. So I want to thank both of you so much for your time that went into preparing for this, your time today, being, willing to be put on the spot to answer questions as they arose. So thank you so much. For everyone else, don't go anywhere just yet. We are almost at the top of the hour. I promise we're almost done, but we really, being a network that focuses on quality improvement, our own quality improvement is really important to us. And so we really encourage you to fill out our brief evaluation. You can use the QR code here on the slide, or the link will be posted in the chat. It's very brief. And so as we close, if you want to just quickly navigate toward it while you have a minute and it's top of mind, we'd love it if you would provide us some feedback on today's call so that we can use that to inform future events. We'd also love for you to visit our website. And again, lots of resources that are available for the public. In addition to, if you become part of the CSLC, the additional resources that you have access to, but we've got lots of amazing guides and archived webinars and papers and all sorts of things. So I definitely recommend that you check it out. And then we'd love to encourage you to follow us on social media. We've got our LinkedIn and Facebook and X and YouTube, and we've got, all the social media. And so we definitely encourage you to interact with us, like and follow us, let us know who you are, and see if we can like and follow you and keep sort of generating the spread of this amazing work that all of you are doing. And we are just so thankful and appreciative of the time that you took today to be part of this event. And we look forward to connecting with you all again in the future. Thank you so much.